President Biden taking executive action on reproductive health.
2 weeks after the Supreme Court's decision to overturn Roe v. Wade, the president is now taking steps to safeguard some health care services and protect the privacy and safety of abortion providers and their patients.
The executive order directs HHS to identify ways to expand access to reproductive health services, like IUDs, birth control pills, emergency contraception. It's my hope and strong belief that women will in fact turn out in record numbers to reclaim the rights that have taken from them by the court.
Let's bring in CBS News political contributor Zeke Miller. He is also a White House reporter for the Associated Press. And Zeke, we have to ask, the president has faced some criticism, some tough criticism from his own party, that he really hasn't been forceful enough on this issue. Will today's action be enough to appease those critics?
Certainly from the president's remarks and the tone that we heard from him just a couple of minutes ago, it seems that he's heard that criticism and is trying to internalize it. He got the memo, so to speak, from members of his own party here. It is certainly more forceful than we've seen from him. The question is this action enough? And by the president's own words, it's not, because if the goal for Democrats or people who are support abortion rights in this country is to go back to the pre-June 24th, before the Supreme Court ruling that status, this is not going to do it. It's not going to come close. As the president said, he needs a national law to pass through Congress that he can sign, and he doesn't have the votes to do that right now. This is really helped out on the margins. It will have some effect, but this is not going to go to turn things back to where they were, just 2-3 weeks ago.
Right. So, Zeke, to your point, realistically, what impact can these executive orders have on reproductive health in this country? Where specifically can they move the needle? Because, like you said, this could be looked at as a political move by President Biden to respond to those Democratic critics that say he needs to show more anger on this issue. What realistically is it changing?
This is just formal guidance to the Department of Justice, the Department of Health and Human Services, that they should go to bat for women trying to access abortion services in states where there are restrictions or outright bans, or try to cross state lines to do that. That doesn't mean that those agencies can actually protect it. It means that they might go to court to try to protect it, but they don't just get tied up in the judicial system. There's also a request to the Federal Trade Commission to crack down on how sensitive data regarding access to reproductive health is shared by technology companies with and doctors, potentially with local or state law enforcement in locations where some of these bans have come into place. That could have some effect if we start to see prosecutions of women seeking abortions in those places. But again, that's really just, get it moved on the edges, on the margins of what the president can do here, because he can't actually tackle the core issue, which is, he can't overturn the Supreme Court. And that's his fundamental frustration here.
Yeah, I don't think many people have a real sense of all of the ripples and the impact of it beyond just that one issue.
Absolutely.
Of
it's
abortion.
Still not clear,
it
how
isn't
this
clear,
is all playing
and
out.
it could have devastating impacts on so many different people. So my question to you, Zeke, is reproductive health really going to be an effective talking point for the president ahead of the midterms, or does he risk angering voters who may say Democrats had their chance and they blew it?
That is a challenge that the president has faced, and that's one of the reasons why, talking to White House officials in the 2 weeks since the Supreme Court ruling in this case came down, that the president had been a little bit more muted on this, because they don't have the votes to do this now, and Democrats have unified control of Washington. And the president bowing to sort of the political realities that even with 50 Democratic votes in the Senate, that's not enough, because there are at least 2 Democratic senators who don't want to get rid of the filibuster and change Senate rules to allow a nationwide bill to sort of to establish abortion rights nationwide to become law. So he needs voters to act. The question is, we're 4 months or so out from the midterm elections. This is going to animate some voters on both the left and the right, likely the left more. We've seen survey data already in the past couple of weeks that show that. Can the president keep that enthusiasm alive and also avoid the backlash of where were you when you had the chance?
Mm-hmm.
That's going to be a real challenge for the president and for the White House as they, go over the next 4 months.
All right. Well, Zeke Miller, thank you so much for your insight. We appreciate it.